Thank you for this invitation. I should note, yes, I'm using HRC slides, but I am speaking as myself. Obviously, though, and when you hear what I have to say, it'll be obvious to those who know me that my thinking is informing the way I try and do my job, always has, always will, so a bit tricky to separate the two. So as some have said already, in so many ways, COVID has given us a great example. Kamihi Sue Kringle, as your kōrero was a fantastic thing just to come immediately before mine, yeah, tie in pretty well actually with where I'm going to go. But COVID, a fabulous example, I think, of how our system and processes work against our collective aspiration for a fair society in terms of health and well-being outcomes, despite a lot of effort and opportunity. It's reminded us so well that our systems and processes and institutional arrangements, the sorts of things you were referring to, Sue, for influencing policy and public health and clinical practice, it's all perfectly designed for the outcomes we get. It bakes in health and well-being inequalities. And I would say there's actually not much point in getting any more evidence into practice if the benefits of doing so aren't fairly shared. And the new health system arrangements are, in fact, a great opportunity to choose, to actively choose in all places in the system to create this different future. So I'm going to go through some pretty high level thinking. It's not all about research funding. Sorry to disappoint. There won't be many specific clues for anybody. Possibly provocative. And really it's a distillation from my various lives as a researcher, a practicing clinician, and having been lucky enough to have had some seats at various influencing tables in a number of settings over my career. But given that it's high level, I'm hoping that everybody here will be able to relate to their part in the wider system. And yeah, I'm hoping to kind of provoke a little bit of self-scrutiny because I think that's where it all has to start. So what are the key elements for potential change? Or put another way, why have so many efforts to get change that I've been involved with in the past actually failed? I'm not, you could say maybe I'm the single common pathway there, but hopefully not. So starting right at the top, so what future? And others have alluded to this. So what is the new health future we want? And I think Te Tiriti is, you know, it can be our superpower actually, because it demands both the arrangements and the behaviours of all the actors that will support our shared agenda. So we have a chance, it's more structured in, it's a bit more in the process, but I think the history tells us that the forces sometimes work in opposite directions, and we will all have to be to step into the space courageously, even for those of us who may not feel that we have high levels of cultural competence and may feel a little discomfort, may feel a lot of discomfort. We have to be generous and be willing to step into this place if we truly are going to be behind this aspiration. So the Tiriti, obviously, but alongside this, we always also have to recognise that inequity plays out in a whole lot of ways other than ethnicity: age, urban, rural divide, rainbow communities, disability communities, etc. So the equity lens needs to be broad. Power, influence, resources. Those at the HRC have heard me talk a lot about power. Look, we have to think about, I'm just thinking of most of the people here, you know, we're all in positions of power and influence, and we all have, to a greater or lesser extent, or many of us, resources at our command that we can draw on. Now, we have to embark on some courageous self-scrutiny here, because power, influence, and resource needs to be redistributed. This has to happen for real. It has to drop down into all the institutional arrangements and the ways people are incentivized to behave, both in the production of clinical services, if you like, and in the production of research. Values and principles. All organizations have these, and, we all sign up to various different ones. I would just say, keep them really simple, but by heck, know what they are and use them to navigate when you're making hard decisions, wherever you sit in the system. Governance. I've seen lots of examples of non-governance in governance groups over my career, and no doubt, I've probably undoubtedly contributed to bad governance at times. Often we say what is governance isn't actually governance, and we need to, I think that for change to be effective, we really need to aspire to the highest quality of governance we can get. And governance isn't always about representation. It's about moving towards the agenda on the basis of the values and the principles. And that's all I'll say about governance. And leadership. So leadership and governance go together, but most leadership actually doesn't come from governance in organizations and in processes. And leadership, in my view, can come from anywhere in the system. This is an attitudinal thing. It's about inviting leadership wherever it's going to emerge from. And that could be something that really makes quite a profound difference. There's huge potential there. And those of us who are in leadership positions need to accept that the leadership may not look like us, and that will almost certainly be a good thing. I did say I'd be provocative. So we need an enduring commitment and courage and commitment to the change. And so, okay, just drop down for a moment. So what might an enduring commitment to innovation in a health service look like? Well, it might look like a commitment to the buyout of time for clinicians of all shapes and professions to spend doing research and thinking about innovation and building the system changes in their part of the system. It can't, it's not a hand-to-mouth, spare time, hobby kind of activity. It's a sophisticated professional activity, and that needs to be valued in the system at all levels, including in the resourcing. And that means choosing that over something else. Okay, it's not always about just asking for more money, which, just getting more money often doesn't help. Commitment in the generation of research. I'll move down to the settings for the production of research. What are the features of the institutions that generate research, which are largely universities, but not solely in Aotearoa? What are the features that bake in the inequities that we're trying to overcome? Bit of self-scrutiny required there. Settings for provision of policy and practice, I think, I would argue exactly the same. I have sat in many groups and committees over the years where we just have not had the right people at the table, and that's probably been because of biased institutional and social practice in the institutions. And I would just say, if you haven't figured it out already, I'm all about choice. And that is because every decision we make is a choice, the big decisions and the small decisions. And let's be deliberate about our choices. So this is the last slide. I only had two. So what do we need to do? What are some ideas about actions? Those were thoughts, ideas, concepts. What about actions? Okay, so those of us who sit at the top table need to think about when it's appropriate and it may not be for us to decide that, be willing to graciously vacate. Those of us in the kitchen may need to move aside. Be part of the culture change. We're all going to be part of it. This is a culture change. We have an opportunity for a massive culture change. We're all going to be part of it, whether we like it or not. We can lead, we can be a fast follower, or we can adapt slowly, but we can't avoid it. We have to be willing to give up the old and familiar, which includes power and resources, but the way we've always done things. And I'm thinking about clinical practice there. You know, we do things as clinicians so much out of habit, and so often where there isn't, in fact, much evidence. Always consider unintended consequences, because there always are some. And I'm thinking there actually of our efforts in the HRC with our equity-based COVID research round that we did rapidly last year. And when we examined it afterwards, you know, we tried really hard for the equity agenda to be really structured into it, but we just didn't sort of get there. So, you know, there needs to be, you need to try things out and learn from mistakes, which leads to developing our risk appetite in different parts of the system. We need to think more like innovators, whether we're clinicians or policymakers or researchers. You know, failure can be a success. This is what we tell our children. To try things and be willing to fail and learn from them. And we need to practice that a lot more. And that means the short-termism of funding programs and, you know, tests of things that, you know, government agencies tend to do. You know, they'll try out a pilot program, and then if it doesn't work, that's the end of it. Or if it does work, that's the end of it, which is another thing I've seen. Choice, I've mentioned it already. We have to be really deliberate about our choices, even the little tiniest choices that we make every day, about who to include in conversations, who not to include. You know, everything, the micro choices are actually where a lot of the power for change can reside. Embrace flexibility and variety at the flax roots, which is not music necessarily to a bureaucrat's ears. Speaking as a bureaucrat for a moment, and because it makes it really complex and hard to monitor and hard to tell what you've done, hard to tell what you've started and finished. But actually, one size does not fit all, and we probably all agree on that. And we need to listen to those at the flax roots, because they will have the secret key to how things can work. And we have seen some of that among Māori and Pacific communities with COVID, where the bigger system has allowed that to happen. And finally, we're all impatient for it to be different. When we don't get our way the first time, it's not about throwing our toys or trying to exercise our power in ways that that might get a short-term sort of benefit. We have to remember the long game, the structures and processes we put in place, and the behaviours that we try and engage in. They need to be fit for the future, not the present and not the past. And that was all I wanted to say. Thank you for your time. Ngā mihi kia koutou.